Um, hello. My name is Nathan Levine. I am a second-year medical student in the UCSF Joint Medical Program. I'm also a member of the UC Berkeley chapter of Students for a National Health Program, or SNaP. And we are one of the co-hosts of tonight's panel, along with the SNaP chapter of the Keck School of Medicine at USC. So before we get started, I had the little check-in question on the slide just to see how everyone's doing. Again, acknowledging how extraordinarily difficult these times are right now, and everything that we're going through. We actually, UC Berkeley SNaP held a panel in April on why the COVID-19 pandemic is showing us why we so clearly need universal and affordable healthcare. And of course, we've also been facing an administration that hasn't been taking charge and has been sort of actively working against the resolution of this pandemic. So recently, of course, we had the 2020 election, and with that, the election of Vice President Joe Biden. So I personally think this is a very hopeful moment for our country, but obviously a very complicated one as well. So I'm really excited to have our three panelists here tonight. And we're going to have a conversation about the fight for Medicare for all in light of these recent elections, and hopefully give us a path forward in terms of concrete actions that we can take. Especially, I know we have a lot of healthcare professional students on this call as well, and a lot of members of other SNaP chapters. So that's very exciting. Okay, so with that, I'm going to pass things over to our two moderators for the evening. We have Amelia Domovska, who is also in the joint medical program with me, and Katie McClung, who is at the Keck School of Medicine at USC.
Thank you so much, Nate, and welcome to everyone. It's so nice to see your faces and to have a little bit of a sense of community, even while we are all navigating these difficult times. We are still waiting for our third panelist, Maureen, to join us. However, we want to be sure to get started. I think she's having a few technical difficulties, but we are looking forward to having her join us soon. Until she does join us, I'd love to just start by asking Dr. Sriram and Dr. Marya to introduce themselves. And since this is also such a difficult time, we'd love to hear from both of you a little bit about how you've been finding ways to stay healthy and stay grounded during these difficult times. If you could share a little bit about your work, what you're doing, why you're passionate about single payer, and again, how you're finding ways to stay healthy and grounded. And if anyone would also like to share in the chat, anyone who's in the audience, about what they're doing to stay healthy and grounded during this time, we'd love you to add to the conversation in that way. So let's start with Dr. Marya.
Hi, thank you, everybody. It's an honor to be here with all of you. I'm speaking to you from the Ohlone territory of Huichin, where I live, which is now called Oakland, California. I work in Yalamu, which is now called San Francisco, California, and I believe that this fight for single payer is a long fight of recognizing the violences of our society that are inherent in the structures of how this whole society is arranged to keep these things scarce and to keep these things available for so few people. I have been keeping myself healthy. I was exposed to COVID at work in a high-risk situation, so I had 12 days of quarantine in which I sunbathed daily and had a lot of time for exercise. I joined the Peloton app, which is $12 a month for digital access to thousands of classes. I highly recommend it. And then I've been writing music. I've been also working on a book on inflammation, and those are the things that have helped keep me going, and then snuggling my children as well, being a mom.
Thank you so much. Dr. Sriram?
Yeah, hi everyone. My name is Sanjeev Sriram. I'm a pediatrician in Maryland, and I practice in Southeast DC, doing a lot more telemedicine. So I'm still kind of like in Maryland as I'm seeing people in the DC metro area. I have been trying my best to continue my campaign of All Means All. It's dedicated to making racial equity a cornerstone of Medicare for All. We got off to a really good start, and then the pandemic hit. And so at the end of February, I, with my team, had produced fact sheets for every single congressional district across the country that shows the number of people who are uninsured, and juxtapose that against the disparities for people of color in every state. And so that's been kind of my my latest work with the Medicare for All movement. I think it's been eye-opening for a lot of people who are veterans of this movement, and for people who are newcomers, to kind of look at Medicare for All through a racial justice lens. And I'm hoping we can talk a little bit more about that this evening. As far as what keeps me grounded, I think being a parent definitely has a way of doing that. Children's needs are much more concrete. They're focused very much in the here and now. It requires being ever present. My daughter is is 3. She's at a great age where she's quoting her favorite moments out of Sesame Street episodes. And if you are in on the joke, it's hilarious. And if you're not, then you're getting laughed at, and that's hilarious too. So that definitely keeps my spirits up during these challenging times.
Thank you so much. And Maureen, I just saw Maureen Cruise join, our third panelist. Maureen, if you could, thank you so much for joining. And if you could just briefly introduce yourself. And we also have a check-in question about what you've been doing to find ways to stay healthy and stay grounded during these difficult times. Maureen, you're on mute. So you just need to unmute, and then we'll be able to hear you.
All right, there we go.
There we go.
Hi, I'm delighted to be here with everybody. Thanks so much for having me, and I hope to learn a lot from you as well. I'm a registered nurse. I'm longtime retired. I've been working on single payer healthcare for about 18 years. I'm director of Healthcare for All Los Angeles, along with a co-director, Erica Ferriston. My background in nursing was I worked for LA County Department of Health Services as a clinic nurse. What keeps me healthy? I try as often as I can during the day to stop and just be in the moment and feel what it is to be alive and well and standing upright, healthy. I also take walks every day. And I enjoy my grandchildren. I was seeing them regularly before the pandemic, and we just continued. So I have 3 grandkids, and I spend time with them. And it's wonderful to spend that time with them.
Thank you, Maureen, and thank you so much again to our panelists for joining us today. I'll pass it off to Katie, who is one of the co-leaders of the USC Keck School of Medicine chapter of SNaP, to ask our next question for the panelists.
Okay, hi everyone. Sorry, I'm on 3 devices right now, so I'm looking all over the place. Anyone of the panelists who feels inclined to speak, please just go ahead and kick us off. But we're wondering what the election of Joe Biden indicates for the possibility of a single payer movement or a single payer healthcare system in the United States, as well as how we can push for Medicare for All under a Biden administration. And if anyone would want to explain for people who don't have as much literacy what a public option plan means, and so how we can kind of operate within a public option framework to still try to push for single payer healthcare.
I'll jump in. I would say Biden has shown us that he's not our friend. He has lifelong advocacy for the capitalist and corporate capitalist system of corporate enrichment, using us as profit centers, our bodies as profit centers. I'd say one activist said that we did not elect a champion, but a new target. So the second part of the question is about the public option. Okay, his idea is to add a public option, which would be, we don't know the details yet, because what is said during a campaign is different than what emerges after one is elected. So we will see once he's installed. But a public option is basically another tier of care that's added on top of all the other tiers of care, which means the silver plan, the bronze plan, the employer's sponsored plan, the Medicare plan, the Medicaid plan, and now there would be a public option plan. And that would be a system that is funded by the government, either in part or in full, by our tax dollars. So we don't really know the details of his plan. We don't know how much of that will be administered by private insurance companies, how much money will be extracted from the system. So that all remains open. So that's what public option is. Anybody else?
Yeah, I would love to jump in. Thank you for that. And I love your Via Campesina representing there.
Thank you.
I'm married to a farmer and I'm involved in lots of farming movements. I see Joe Biden as, you know, that we have experienced the threat and terror of neo-fascism under Trump, and now we get to go back to the terror threats under neoliberalism of the Obama, Biden, Clinton reality. And for Medicare for all, it means that if we actually want single payer, which is the only way we're going to be able to get cost control in our healthcare system in the United States by abolishing the private health insurance industry, if we want that, it'll be something that the people will have to fight for, and they'll have to fight for it in the streets, in the way, much in the way of your backdrop. And by that, I mean coordinated labor action. So this is a time to really think of the importance of coordinated labor actions, withholding labor, and it'd actually be a great time for people to withhold labor, especially essential workers who are at highest threat of contracting COVID, and many of them have workplace problems with regards to safety. But that is, I honestly think, the only way we're going to be able to raise this issue to the level of seriousness is to demonstrate to our country that you know, over 70% of Americans want single payer at this point. We need to radically shift our energy infrastructures. We need to radically shift our healthcare structures, because they cannot support the threats that are happening actually right now in real time as they are. And so I think that, you know, I was thinking today, how do doctors strike in the midst of a pandemic? How do healthcare workers, how do nurses? Are there ways we could be creative about our own labor actions? But one of the things I was thinking of, you know, people should strike so we don't have to, because we need to be in the hospitals, we need to be in the clinics, we need to be doing what we do and what we love to do, which is not making money for insurance companies, but serving the people with as good healthcare as we can possibly give. And so I think that we need to start looking nationwide at street level coordinated labor actions to demand the right for every person in the United States to have access, full access to excellent healthcare, and to abolish the you know, the structured several level system that Maureen was just speaking about. We need to reimagine healthcare.
Yeah, I agree on, you know, on all fronts. You know, what is the public option? Great question. There's no clarity whatsoever on what the heck that means. And that is largely because we had a culture of non-journalism. It was mostly, you know, kind of tabloid coverage of politics that never dug into what does a public option mean. I mean, we've heard these two words uttered again and again and again for getting close to 2 years now, maybe 3, and nobody really knows what it is, right? And so what we do know is what Maureen and Rupya were talking about, which is that it's yet another fragment in a ridiculously fragmented system. I think that is an important value that we have to communicate, that like this fragmented system is not functional. You know, the other element of it is that, you know, during this entire political process, right? Like when they were talking about the public option, does anybody know if the public option is going to cover undocumented people? I don't. Does anybody know if it covers reproductive health, meaning including abortion services? I don't know if it covers that. And I think that, you know, these are the important questions that if our members of Congress want to talk about a public option, be clear about it. Be clear on what this is and what it is not. How public is a public option if it's going to be in any way administered or augmented or influenced by private insurance companies? Is that still public? So I think that there's like, we've got like a ton of mystery, and I would call, and quite frankly, I feel it's nonsense around this public option myth. Whereas we have like very real needs. We have very real material needs, and we've got a myth that is supposed to answer them, which I think that the more that we actually, confront that we have like, you know, we have been sold a myth that is the public option, and that we represent people who have real material needs in the most horrific ways possible because it is a pandemic. It's time to call BS. The emperor has no clothes on healthcare, and you know, I think that the more that we're able to assert these values, and really to assert it in the form of question, right? That like, you know, does the public option cover undocumented people? And to let the question linger there, let the awkwardness of, you know, like a lot of corporate Democrats, because like we know that this has historically been an easy compromise for them. You know, like, and to point, like, you know, does this cover abortion? Again, let the question linger and let them sweat and let the sphincters tighten up, because that is going to assert our values of what we mean when we talk about quality healthcare for everyone. And I think that by doing that, you actually assert influence in a powerful way that really like holds the line on values that I think, gets completely lost in these discussions, and is also very concrete values, as opposed to this very nebulous discussion of this two-word policy of public option.
Right, and I also think that, on to your point, which I completely agree with, that we should just be framing it as the public option is not an option. And this isn't an option because it will create a tiered system, which the private health insurance companies will constantly try to erode the value and the legitimacy of public-based healthcare. So I don't think that we can tool our way to the solutions we need at this point. Obamacare was the attempt to do that. It failed, even though it did provide greater coverage. Ultimately, it's a neoliberal expansion into healthcare. We need to just, it's a great time to reimagine it, because even the idea of employer-based healthcare at this point is wild, as so many people are losing their jobs and shifting their jobs and ending up in these spaces of not having enough coverage.
Yeah, I would like to add also, I agree with, of course, everything that's been said. I think we're all on the same plane there, is that at the very outset, a tiered system is apartheid. It is a system of supremacist ideology of the privileged. It relies on people who have advantages and people who have disadvantages. It cements poor care for poorer people. It says all lives are not equal, and we have a system that has institutionalized that, and we've accepted that as the norm. I mean, we can't expect to remove racism or discrimination from our society if we continue to say at the most basic issue of life and death that some people deserve to live and others don't. We know that Medicaid is an inferior system, not because of the providers involved, but because of the way the system is set up. It's inadequate. And public option is just another inadequate system. It's what CNA calls just another Band-Aid on cancer. Right. Public option does not provide a solution to any of our problems, to any of the inadequacies and any of the injustice that's in our system now. And we want a system that's just, that's equitable, that's accessible. 70% in California, 71% of all healthcare costs are already publicly funded. So to deny people publicly funded healthcare that we are already paying for, in essence, we're already paying for that, is really an outrage. It's a scam. Insurance is a scam. Insurance has no place in healthcare. Healthcare is a social good that requires investment. Insurance is an extraction, and public option allows that to continue. At its best, it just allows that to continue. At its worst, we will be siphoning money away from the public option system. If the principle of single payer is that we all have one system of care. We all have one level of care. And that means Governor Newsom and you have the same care. Your legislator and the homeless have the same care. If that were the case, I guarantee you 3 things would happen. We would have everything we needed. It would be top quality and it would be funded. And as long as we allow a second system for privilege, we are never going to have an equal system. We are always going to be at risk at having funding cut, at having Congress cut the budget. We need to be in one pool, all of us, and we need to remove the for-profit insurance industry from the healthcare system. They don't belong in healthcare. They're practicing medicine without a license. They've hijacked physicians and they've hijacked nurses. They've taken over our jobs, and really to the detriment of people, which is why we're #1 in the world for preventable death.
Yeah.
The United States is #1.
Can I just say, I know we could talk about this all night. Maureen, I think what you brought up was such a beautiful analogy to the extraction, because if we look at what is happening with the fossil fuel industry and how it has eroded the health of our society, how we can actually, this is such an amazing moment to reimagine these structures. I'm involved in helping to support a clinic going up in Lakota territory on Standing Rock, where I served during the protest camp against the DAPL pipeline, and the elders there asked me to help form a clinic to decolonize medicine. And as we've been working on this, from a clinic to a clinic farm school, and now they're putting in a giant wind farm, and it'll be owned by the members of Standing Rock, and they're going to be using, selling the energy and using the sales to fund the clinic and the school to decolonize medicine. And I'm like, oh my God, this is amazing. What could happen instead of PG&E, let's say in California, killing more Californians every year with their dysfunctional equipment and infrastructure because they gave their corporate executives payouts instead of fixing the infrastructure and keeping us safe. We could have a energy system that is owned by the public for the public good in California, and that the money that is generated from that infrastructure could be used to fund our healthcare system on a microeconomic level. We could be looking at oil severance taxes, which we're not doing. There's so many possible income sources that have not been tapped in various parts of our country that target those industries that are actually making us sick, whether it's the fossil fuel industries and all the chemicals that come, whether it's pesticides or the forever chemicals that are in our bodies, the cancers that we're seeing in the hospital. I work as a hospital medicine doctor at UCSF. I hope I get to have some of you on the clinical side when you're ready. That we see all these things, these industries are causing them. They're making tons of money off of it, extracting the health from the people. Those industries need to be taxed for our health, just like tobacco was. And that money needs to go back into the public good to fund our health and well-being. So when people tell you there's not enough money for this, $3 trillion have evaporated from the public good. Like our money, our taxpayer money has evaporated since COVID. It didn't go to make us PPE. There's still nurses getting exposed on the job. Where is that money gone? So next time people tell us there's not enough money for this, we just need to say again, like, bullshit. There's plenty of money. We just need to have full transparency, full accountability, and decide as a people where we prioritize. And it sounds like a vast majority of people are starting to prioritize climate safety. We're tired of running away from wildfires. We're tired of breathing crappy air. We're tired of our hurricanes and things and blowing down our houses. And we're tired of not, going bankrupt when we have private health insurance. It's still, even with Obamacare, it's still the #1 cause of personal bankruptcy. So we are done with the financial tyranny. We are done with the tyranny of extractive industries. And Maureen, I say that because you mentioned I've never heard of healthcare insurance described as an extractive industry, and I think you're absolutely correct.
Yeah, I mean, and how else could you describe it, right? I mean, like when United Healthcare like makes, $6.7 billion in their, COVID quarter, that was like, I mean, the months of April, May, June, it's like, and that is the company's like highest profit margin quarter in the company's history, right? So it's like, if you are like doing your best when, I mean, health is at its worst, then I mean, like, you are no longer a good faith player in healthcare. Like, you never were, but like at some point, like we have to be, I mean, forcing the issue of like, you are not a good faith player in healthcare. And I think that, and it's worth at this point in history to really challenge the assumptions that were made when the ACA was being drafted. The assumptions were that, oh, if you give, the insurance industry, tens of millions of customers, and you set up like some very like, reasonable rules of the road, don't put rat meat in the burgers, when you sell a policy, make it easy to understand. I mean, everybody on this call is probably more adept at buying a cell phone than they are at buying a health insurance plan. And the sad thing is that we are all people in healthcare. Like, I mean, we're probably among the best educated people on the planet, and yet we would struggle if we had to go through the process of buying a health insurance plan, right? But the ACA, the assumption was that if you, tighten up the regulations, just and give the industry 20 million or 40 or whatever millions that they assumed, that this would entice their business interests to be a better faith player. Now, this is what they assumed. It is reasonable 10 years later to ask, how did your assumption play out? Did it really come to be that, like, that you have good faith players in healthcare? In the midst of a pandemic, great time to test it, great time to ask, like, how did that assumption work out? And we're finding out it's not working. And I think to challenge, the powers that be in, private and public, to challenge that and to say that this assumption failed. And it's okay, like, if you were like, I at the time like that the ACA was being drafted, right, I felt that I bought that assumption. Like I mean, like, I was one of those people who thought like, oh, okay, like, this seems like, let's roll with it, let's give this a try, right? And if I'm willing to go back and understand that an assumption I made 10 years ago did not pan out, then I feel like it's a fair thing to do. I think that we are forgiving people that if assumptions you made 10 years ago did not, manifest the way that you thought or hoped that they would, it's okay to abandon those assumptions, cross through, that portal, and like, and build something better and new. Like, don't keep forcing old assumptions to work when they repeatedly tell you that they are failing.
Yeah.
Right. And this is, yeah, sorry.
Can we maybe also pose the question to you all, because we're loving just this amazing back and forth dialogue, but to frame or to ask what medical students can do uniquely to fight for single payer at this moment in time.
Yeah, so I'm going to borrow what Rupya was talking about, which is that about the withholding of labor, right? Like striking.
Interesting.
What does it look like when medical students strike? Okay. To me, like, nonviolent civil disobedience, right? Like, what does it mean to disobey as a medical student? What does it mean to look at what work is being valued on your parts that systems like would actually start to tremble at, right? If medical students suddenly decided, and it does take organizing, because let's face it, like, there are, y'all got classmates who are not in this discussion right now. And when I suggest something like, how about we just don't show up at grand rounds? Like, that's something that all levels of, of healthcare can do, right? Like, if we decide that we're not going to show up at grand rounds, We're not going to show up at noon conference. You know, like these are things that don't hurt patients. It doesn't hurt a patient at all if a doctor doesn't go to grand rounds, but it does piss off the chairman of your department if, like, you know, if doctors repeatedly don't show at grand rounds. And that is an opportunity, like in that tension and in that like moment, that is an opportunity to push and ask. What is it? And then and it's important to know what will that ask be before you even do the action. You've got to know what the ask is, because it's like, it's not enough for like a disorganized like bunch of like asks to suddenly like pop up like discombobulated before this like ticked off chair, because that's when consequences start to fly.
Yeah,
But
so I
if,
think that's a great idea. Like, I think imagine if medical students were to say, we refuse to participate in the system until everyone's covered. We don't want to be doctors in this system. This is a barbaric, cruel system. Look at the pandemic. Look at what's happening. So if the moral authority of really thinking about the weight and the place of burnout that we all experience as working physicians, one of the things that happened at UCSF during the pandemic is that one of our colleagues discharged a patient who was unhoused, and there were no hotels. The board of supervisors approved 8,000 hotels to be bought by the city. The mayor basically refused and wouldn't let people in. I think about 2 or 2,400 ended up getting into these hotels, but far more people are still on the streets of San Francisco. And one of these people ended up dying on the street corner shortly after. And his course looked a lot like COVID from December through the time when he died. And it just threw a lot of us in the hospital into like, what can we do? And one of the things I was like, well, what if we just refuse to discharge unhoused people? What would happen to the health system? I mean, it would freak out. And it really upset like a lot of my colleagues. And then my division chief got involved and like, oh my God, I don't think we can do that. It'll be really upsetting. And it just showed me like how potent it is when we coordinate action. It is extremely potent if we say, we're all going to code every single patient at level 1 until you give us Medicare for all. That means no health system will make any money off of any patient I see until you do this. So I'm just going to write, my notes won't document people at the level that you can code for a lot of money. That has its consequences as well. Like people will have to suffer consequences if you take these kinds of stands. But these kinds of coordinated actions we can take, whether as medical students or working health professionals, I think are really important. I just would argue, like, let's not make them performative. Let's not make them die-ins. Let's not make them petitions. Let's actually coordinate, work with the unions, go meet with the union representatives of the nurses and the RTs and the PCAs and everybody, and start working together and say, how do we make sure that we can do this together from a health system standpoint without compromising patient care, but also understanding like what role we're playing as the cog in the system and how we can shift our shape so that we can get a better outcome. But I also think that what med students could really do is shape the message for the general public so that people will walk off their jobs and stay home, that people could start organizing mutual aid societies to make sure essential workers who are low-wage workers could be paid through a strike and not suffer with their families, and that we could all together like push a general. I think that we will need a general strike. And the reason I say this is because FDR didn't like poop out the New Deal on his own. He was just a person who could be pushed by the people. All the wins of the New Deal, which were, some of them were great, some of them not so great, but all of them came from people power. They didn't come any other way. And so that is what we need to engage in. It will be the movement of our generation. We need to, this and climate. And these are both movements of care, of centering care, of centering another way of doing things that is not the way this country was built through genocide and slavery and this racial hierarchy, which has been enforced and entrenched in every level of our society. That once we start restructuring those things, we have the opportunity for true care. And so that framing, I think, would be really important for medical students to do.
Yeah, and I mean, and the urgency of the calendar cannot be understated. I mean, to me, I actually got kind of nervous when I, heard the news about a vaccine, only because I I know these policymakers, and these policymakers don't think about public health and medicine. They think about vaccine, and they think like, oh, good, science will do the work that I don't have to do. You know, they really think that the end of this pandemic is going to be that the vaccine will get distributed somehow, and that enough people will take it somehow, and with it they will be able to join bosses and say, here's your shot, go get go get vaccinated and get back to work. Like that will be, like that is how they will build unity, you know. And then the other thing that will come to their rescue is when the Supreme Court upholds the ACA. When I heard I heard some of the recordings from last week's the ruling, or when they were hearing the case. And I was already kind of, doubtful that, that the Roberts Court was going to strike down the ACA. It's one of those, I think that he's a very shrewd Chief Justice, in that he will bring the case before the Supreme Court in order to appease conservatives. He will not strike down the ACA, just because, one, it's really flimsy as a case in and of itself. I think that he'll probably be joined by either Justice Kavanaugh or Gorsuch to uphold it. And when that ruling comes out in June, the timing of it will be such that like the vaccine would have reached a lot more people. It would have, and with that, and with the ACA being upheld, you will have a lot of policymakers breathe a sigh of relief, saying that, oh, good, the stuff that we burned political capital on before is going to save us. And now please don't make us do anything else. Please don't ask us to do anything else, because we did it, and it'll be the mission accomplished banner all over again, right? And that's why, now is the time to begin the organizing that Rupa's talking about. Now is the time to figure out on that calendar, like, when will you apply pressure? Because, time is working against us. There is a lot of apathy out there that is just desperate for, the ACA to be upheld, the vaccine to make it out to people, and for people to just shut up about the pandemic.
And that's on the national stage, and I just want to add some California perspective. So on the Healthy California for All Commission that I serve, I was appointed by the governor last year. We are tasked with providing developing a unifying financing structure for universal healthcare in California, not limited to single payer, but single payer is definitely the way that I think that this could be possible in California. Regardless of what happens on the national stage, I think we need to start in January. We start the commission meetings again. They were stalled because of the pandemic, but the pandemic really did allow those of us who are pushing hard on single payer to push the issues of racial equity, to show the hypocrisy of
Uh-oh.
You froze.
Yeah.
Looks like Dr. Marya has frozen. But Maureen, I know you've been trying to comment
Yeah.
for a while, so why don't you go ahead and
I
we
just
can
wanted to make a quick
circle back to her.
comment. In terms of what medical students can do, health professional students, those were fantastic suggestions and very strong, but we're really going to need a lot of the population to join us. We can't just have health professionals. It's going to go nowhere. And we're going to need a bill to go through the legislature. So we're going to have to address those issues as well. I would suggest that for health professionals, that you use your capital as a health professional student to, first of all, you educate yourself and participate and agitate. You can do simpler things like write op-eds, tweet, comment to anything that you see on Facebook. First of all, educate yourself though, so that you know that you can answer these questions. Also, to do outreach, what you're doing right now is good. You can show films. There's a wonderful film, Fix It, which is a great film. And if you yourself don't feel that confident in all the ins and outs of single payer, you can just host a panel discussion and let other people talk about it. Whatever actions, you could join with other groups in solidarity with other issues as well. We've got Democratic Socialists, we've got California Progressive Alliance, Healthcare for All, Progressive Democrats, Poor People's Campaign, Black Lives Matter, Mi Gente, a lot of groups where there's an intersectionality of all the issues around human rights and human justice. But the thing about any actions that we take, they need to be sustained. There has to be some real visibility because media matters. We also have to use the kind of pressure that is not only is rooted in truth and a moral base, but something that really have a consequence for the political class, our legislators. So there are, many things to do, but I think exposing the injustice, you have a particular advantage, and that in the healthcare professions, we can expose the cruelty and the viciousness and the violence of this system. We see it up front, we see it firsthand, we can talk about it. So short of striking, which is not a bad idea, there are other things that people can do just routinely. We need a sustained movement. We have to sustain that voice that says it's not a financial problem. 22 studies over 30 years have shown that we would save money. Every country in the world that uses some form of single payer shows that they can save money. So it's not a financial question. That issue is solved. Yeah. It's not a question of policy. We see this done all over the world. That issue is solved. It is a question of getting our political class to do their job. And their job is they were elected to represent us, to take our tax dollars and spend it on our needs. And there is no more important issue than the health and well-being of the residents of this state and of this country. And I would say it's broader than medical care. Medical treatment is part of a healthcare system. It's not the whole healthcare system. A healthcare system involves everything that ensures the well-being and the health of its citizens. And that includes food security, clean water, housing, education, parks. All of those things are under an umbrella. Public health has been decimated since the 1980s. And we need to get back to the idea that we have a healthcare system which incorporates medical care, of course, but we need public health as well. And so anyway, I think we're going to have to push our legislators to actually act on this. And that's going to take a sustained, visible, public campaign, really, joining with other organizations.
And one of the other things that's on, I would say, on a California to-do list is that you've got to, now that Senator Kamala Harris is becoming Vice President-elect, Kamala Harris, I believe that now is the time for California to push for a, senator who is a strong Medicare for All, Green New Deal, progressive that is vocal, unapologetic, and fighting for it. Be smart about who you send, because if you send over someone who is currently a representative in the House, and they come from a district that will not replace them with another progressive, then you're just going to, it's not increasing the team of Medicare for All in Congress. So what I mean by that is that, let's take, for example, someone like Katie Porter, who, I adore. I think she's fantastic as a member of Congress. She comes from Orange County, California. There are a lot of wealthy Democrats who could fill that seat and might not share these values. And so you got to be cautious about, sending someone like her. I mean, same thing kind of goes for Ro Khanna, another person whom I really admire and respect. Silicon Valley has got a lot of wealthy Democrats that they can fill that seat with, and so it would be great to have either of them in the Senate. But I don't know if it's worth risking losing one of our 112 in the House. And so, be careful about that math. And that's where I feel like, Barbara Lee is like kind of a more reliable choice. But I would say definitely start organizing around finding a senator who will pick up this battle flag, because Lord knows, we need the help in the US Senate for sure.
Thank you all for those perspectives. And Dr. Marya, so glad to see that you were able to return. I want to make sure that we have a chance for some of the questions from the chat. So I did see one earlier from Cole. Cole, would you like to state your question out loud, or I can just go ahead and read it from the chat?
Sure, I can say it out loud. Hi, I'm a medical student from USC. So I wanted to get your perspective on what the place of incremental action is in a push for single payer, because I think that so much of the power of single payer comes from the power of the federal government, the ability to take on debt, the ability to bargain for these drug prices, and the unification of care and freeing people from, linking their healthcare to their physical location. So do you think that it's possible for effective care to be made at the state level? I understand California is a very big market, but it's not as big as the United States. So if you do believe that care could be effective, what changes do you think would be best?
Well, I haven't been to California in about 12 years, so I'm going to let my California colleagues take the California perspective, but I can share a national perspective on that.
Yes, we've had basically 6 pieces of legislation in the last 20 years for single payer. We could do it in California. We are the 5th largest economy in the world. We are the same size as the country of Canada. If you'll really good sources to look up SB 562, the Healthy California Act, read it, have a look at it. Look at the financing piece that the Political Economy Research Institute, Perry from University of Massachusetts, they did a financing report on it. We could definitely have single payer here. In Canada, it started with one province, Saskatchewan. It's not a problem of economics. The state would save, the last report in 2017 was the state would save $37 billion and cover everyone, including undocumented, for all the medically necessary services we need. And that's because about 30% of our healthcare dollars are siphoned away for profit by the insurance business. We also pay incredibly high hospital prices because they charge whatever they can. There's no real price control. We're not able to negotiate for bulk prices from the pharmaceutical industry the way the Veterans Administration does and the way Canada does. So we can do all of those things. Also, reducing the administrative costs is an enormous boon to the system. Physicians alone, the average physician, if he's in a private practice, is spending about $100,000 a year just on dealing with the insurance industry. We have more billing agents than beds in some hospitals. More billing agents than beds. We can get rid of that with a single payer system. We would save probably really up to 50% of what we're spending now and still be able to cover everyone. And there's another very important thing for physicians and for nurses and for everyone working in the healthcare system. And that is, we have nationally, there are about 900,000 physicians. And that works out to be about $868 million clinic hours wasted on bureaucracy, wasted on getting approvals, wasted on filling forms. Those are patient hours. Those are hours that could come back into the system. Those are billable patient hours. Okay, so there's so much more to think about, you know, in terms of what would happen if we had a single payer system, and even beyond that, the medical system, the healthcare. We have healthcare deserts. If you live on the west side, you have a 15-year advantage in life expectancy, 15 years more than someone who lives in South Central. We're talking about a 12-mile difference. We have, we've been really discriminating to the point where we have whole areas that are lacking decent facilities. We don't have enough providers that will see them because, well, first of all, we're wasting all those hours, but also the whole Medicaid system. If every person brought the same dollar amount with them, whether you went to Cedars or you went to Drew or you went to a clinic, the same amount of money comes with you, we would see a greening of communities that are now impoverished and becoming more impoverished because the system we have is bankrupting not only them and their families, but it's bankrupting the hospitals and it's bankrupting the clinics that they go to because they are either uninsured or they're Medicaid. If we had a public option, that would be even a lesser system. So there are so many advantages to the entire state, removing the onus of providing healthcare from businesses would free them up, it would free up more money for wages. Entrepreneurs, people can't go out and be entrepreneurs. We see in Europe, they have far more entrepreneurs than we do who start at a younger age. They start in their 30s. Because they can. They don't need to hang on to a job for their health care. So in this country, people become entrepreneurs after 65. Okay, there's a reason for that. So there's a kind of a freedom. Also the incredible psychological burden of people being afraid of not being able to afford their care. Recent poll, I think it was the last year, said out of 8 things that people in the United States feared the most, 4 of them were about being able to afford their health care. 4 of them. We have 43 million people hounded by debt collection agencies in this country. Those things would disappear. Nobody in Europe knows what medical debt is. We shouldn't know what that is either. Okay.
Well, that piece I think is a really important one to highlight too, because that's an independent risk factor for cardiovascular death. So if you're looking at amassing debt and what it does to our bodies, it just creates more patients in a system where, you know, when you do suffer that heart attack and then you can't work and then you lose your health insurance, then you can't get your meds. It just is, people are under financial oppression of the healthcare insurance industry, and that's what needs to stop. It'll lead, exactly you're saying, to better care, as well as better options for care providers. And if there's any moment to really highlight this, it's exactly what was mentioned before, that we're using record profits for healthcare systems. And I was asked to take a pay cut. We're all asked to take pay cuts in the midst of a pandemic. That's like sending your soldiers off to war and asking them to just take a little pay cut because it's a tough time. That's not the time you start cutting the pay of the frontline workers, nurses and doctors. It's not the time you give us less optimum equipment to be safe in our jobs. And we're seeing how a system that prioritizes profit over people this is exactly what happens. People are getting worse care, and care providers are getting worse support, and healthcare executives are making bank. And that is a system that is upside down and needs to be put right side up. So that I think California actually can be a postcard to the future. We're the 5th largest economy in the nation. I think we need to be changing our energy infrastructure as well, simultaneously, like I mentioned before. I think we need to be eliminating fossil fuel inputs to our food system through eliminating pesticides and synthetic fertilizers, which are all based in the fossil fuel economy. At the same time where pharmaceuticals were positioned as the way that we need to take care of our bodies, pesticides and fertilizers were also positioned as the way we need to grow our food. So we're all waking up from about 150 years of misinformation that was really set in the same time that the current economic structure was built. And so it's a great time for us to collectively wake up and restructure these things. And California can be a wonderful testing ground for that. So I think that we have to push for that here and push for it nationally.
Thank you so much to all of our panelists. I do want to acknowledge that it is 6:32 and recognize that we had time blocked off until 6:30. However, your panelists, if you are willing to stay on, I would love if we can address one more audience member question before we hop off, if that works for all three of you. I'm seeing nods, great. And then of course, invite our audience members to stick around as long as you can as well. So I will pull out a question from the chat that was endorsed by Alan and Rachel, which is asking related to acknowledging the fact that we have the second highest number of votes for Trump ever, I think just following Biden. So 70 million, according to Rachel, and who are actively demonizing Obamacare for being too socialist. How can we actively move towards single payer without furthering these divides? Would love to hear your all's perspective on this.
Yeah, so first off, I mean, I've always hated the assumption that the country is divided. I think that erases the political perspectives and experiences of Black, Indigenous, and people of color, across the board. If you look at the last 4 years of political data, white people are divided. White people, it's always hovered in the high 40s as far as like the approval rating for Trump. That it has never been that high among any non-white voter group. It has never reached that high. Like the highest you get is among a few Latinx voters that have like maybe in the mid 20s, they'll say that they approve of Trump. Everybody else is well below that. We're measuring in single digits. So you have overwhelming disapproval of Trump, conservative messaging, and a lot of what they do. That has held steady across, for years now. Like those numbers held steady during the Kavanaugh hearings, those numbers held steady throughout this election process. So when people say the country is divided, I'm sorry, but that is, white people are divided. The majority of melanin in this country knows exactly where they stand. As far as like the fear of the label of socialist, I think that there's something, I've actually felt like, a lot of pride in being the kid of immigrants, like, during like, when these kinds of questions come up. And the reason why is that my showing up in some spaces is off-putting to people, right? Like, me insisting on my name being pronounced correctly is off-putting. I can't walk away from that just because it's off-putting. Like if you're alienated because I showed up, if you're alienated because I want my name pronounced a certain way, like that doesn't become my problem. Like I have to be who I have to be. So, the moment you decide to, live in the shadow of something else for the sake of like, maybe I won't get bullied this time, I think that you have, it immediately diminishes whatever it is, your identity, the cause, whatever it is. And we know like what we are and what we're not, if people, and to me, like like socialist as a label is, it can be very conveniently weaponized against us. It can become like a source of pride for other people. At the end of the day, like, I am there for the material needs of the people that I love and care about. Like like whether that is like socialist or not, I really could care less, right? Like that that label is not my concern. And so what I usually, remind people of is that let's talk about a concrete experience that all of us have some kind of positive connection to. And I point to the experience of going to the public library with my kid. When we go to the library with my kid and my kid wants to check out a book, nobody is means testing her. Like nobody says like, oh, well, child of a doctor. In that case, you want to check out these books, we're going to need, a copay with that. You can't just like, check out whatever you want. Instead, at the point of service, she is treated the same as the person standing in line behind her. And that is a unifying experience. Like that, going to the library, like most of us like, feel like, our library card is just a natural part of our family experience, like, like when we're out in the world. Getting a Medicare card should be about the same. Like, it really should be that simple. Like that question that was asked about incrementalism, like I like to actually like guide people to that incrementally. Like we know that like traditional Medicare as it stands now requires upgrades. We need to cover dental, vision, and hearing. If we're going to do that, if we're also going to recognize that Medicare Advantage has screwed over seniors, and there are policies that can be put in place to push that back, aren't we kind of building a good public option? And if this is a good public option, shouldn't it be the only option? It's like, I think like there are ways of talking about this in such a manner that bring things down to concrete experiences. Like when I talk about Medicare for all at town hall meetings and things, I frequently talk about this hospital is closing over here, but over in the rich part of town, that hospital has no problem staying open. In DC, like in Foggy Bottom and in Georgetown, those hospitals have no problem staying open. But yet, lo and behold, in the poorer, blacker parts of DC, hospitals can't seem to stay open. What is up with that, right? And it's like when people are able to connect with like Medicare for all to like the hospital next to me is going to, not only stay open, but be a place of healing and thriving. Now we're talking about something that is rooted in my community. It's rooted in my experience. And we're not talking about Scandinavia, which could just as well be Westeros for all people care, right? Like single payer works great from King's Landing to, Winterfell. It's the same thing as talking about like, single payer in like Stockholm or Copenhagen. It's like, it's all, it's white peopling too. And yet, and that point matters because the majority of people of the uninsured in this country, 59% of America's uninsured pre-pandemic, people of color. 80% of California's uninsured pre-pandemic, people of color. We have to bring this down to a rooted experience in the real that has nothing to do with all these bullshit labels and has everything to do with like, what is it that we want for ourselves? And like, should we really narrow our imaginations to whatever Mitch McConnell's ceiling is? Like my brown ass is not here because like, we played nice in the comfort zones of whatever white moderate existed before. We took risks, we took sacrifices, but most importantly, we humanized what it is to exist in this space. And I think the more that we can do that, the more we can free ourselves of these labels and avoid any of these, of these labels that I think confine us and narrow our imaginations.
I think your point is so right that it is that the white people are divided. And I think that what we need to look at historically is other places where white people have been divided. And they were divided about the end of slavery. They were divided about desegregating our society. And Medicare actually played a critical role in desegregating hospital care. So once there was Medicare, Black and brown people were able to go to the same hospitals as white people. And so healthcare has always had this revolutionary, liberatory, amazing capacity to alter and shape society. do we, because it was a divided experience around slavery, do we stop with the push for abolition of slavery? No, we don't. We say, I'm sorry, that system of oppression that you were loving so much and deriving advantage from is no longer acceptable. It's not acceptable, and we are going to get rid of it. And so this is a similar struggle, and it needs to be framed in the struggle of liberation. And so I think that, yes, exactly. Same with prison labor. Exactly. The same prison abolition. I would say, let's just go ahead and abolish corporations altogether, just that corporate structure. And so, but I feel like if we have to be able to accept that, yeah, white people are divided on these issues about giving brown and black people rights, about giving us housing, about giving us safety, about giving us the ability to live full and productive and healthy lives. And that is the system of global white supremacy. That is the foundation of this country. And so what we're doing is we're seeking to change the foundation of this society. And every possible way that we will seek to do this will be very challenging, and we will encounter division amongst white people, predominantly white people. And so that is our task. I would also say our task is to actually reach across the divide to some of those white people who supported Trump, and to have a deeper conversation and analysis of the political ecologies, the economic realities that have put them into the states that they are in, where they are demonizing Black and brown people as opposed to the economic structure that's oppressing them in their communities, that's exposing them to these forever chemicals that are in their water. Look at the Tennessee River Valley watershed, poor people from Alabama who all have cancer. And so even though, and this is where the Black Panthers will always be people I look up to, they understood that organizing with the poor Appalachian whites was equally critical. It was critical to make these alliances and allegiances across the violences of this capitalist racist society. And so that is, I feel, an important, like, it's okay that we're divided. Let's reach it. Our work is really to reach across some of these divisions and seeing how we can educate our fellow human beings who are suffering under the same system, and they're choosing to take a position of oppression when they're not maybe fully cognizant of how they themselves are being oppressed by the same system.
Yeah, as healthcare, wonderfully put, Rupa. As healthcare professionals, we know that suffering creates fear, and fear creates anger. People lash out when they're afraid. What we have is a system of terrible economic inequality. Reverend Barber of the Poor People's Campaign, he stressed that while in our system a greater percentage of people of color are disadvantaged, the greatest number of, just in terms of numbers, victims of poverty are white. And this economic disempowerment really does fuel a tremendous amount of fear. The fact that people are struggling to stay alive, single payer, and so I agree that solidarity is necessary. We need to unite people across what are the things that we need in our lives, what do we want to see in our lives. I mean, the odd thing is a lot of areas that went for Obama did not go for the Democrats in 2016 nor in 2020. So there was some suggestion that this was that election was the politics of kind of resentments and grievance about not having needs addressed, and needs were not addressed during the Obama administration. There's no way that we can say people did better under the Obama administration who are at the bottom of the barrel. So one of the things that a single payer universal healthcare system can do is it sets up a system of inclusion where the investment is in all of our lives and people have what they need. The quality will be high, right? We need high quality, we need it to be well funded, we need it to be universal, and we need one system of care for everyone. This would do a lot toward removing those barriers. those of people who are feeling economically disadvantaged. So Paul Wellstone used to say, we all do better when we all do better. And so what we want is a system where we all do better.
Wow. I want to thank you all so, so much for all your inspiring words. This has been an amazing discussion and fiery and passionate. And I think just what most of us needed right now in this post-election haze to kind of gather everything together and figure out what our next steps forward are going to be. And you've given us so many ideas. If you do have time, I just want to ask one last quick question. If you could all kind of give a quick sort of closing statement about sort of your takeaways for this moment and any kind of like actions that we can take. I know that's maybe impossible to keep brief, but yeah.
I can keep it really brief. Start organizing a general strike across the nation now. General strike until we get Medicare for all. That's it. That's what we need to do. There's no way this is going to happen.
That's it. You're right. That's it. You're so dead on. I'm sorry.
No, say
I'm
it.
thanking you. I'm thanking you. That is so dead on. That's what we must do. That is the only way we're going to get through to people. Thank you so much, Rupya. Thank you.
And me very quickly, I would say one of the things we really have to do, we have to oppose actively and vociferously and publicly oppose all reforms that are not a solution. And anything suggested other than single payer is not a solution. And there's decades of research about this and decades of papers written. So we know we have to insist on equality. We have to insist that separate is never equal. We should not have a system that separates people out, whether it's Medicare, Medicaid, covered California. No, we need to be in one system. We need to remove the profiteers. We don't need insurance. They can't give us a Band-Aid and they can't order an aspirin, okay? All they can do is siphon money away from us for the shareholders who are their true concern. Okay, as Lily Tomlin said once, well, for the insurance industry, we are their business, but we are not their concern. So we have to remember that just keep our eye on the prize. We need a single payer universal healthcare system. This incrementalism doesn't work. And one important thing about incrementalism, how many people died today? How many thousands of people die every year, right? Because they don't have adequate access. And these are people with insurance, right? How many people are on GoFundMe every day begging money from complete and total strangers online so they don't die? Every day matters. Every day people die. Every day people lose limbs that they don't have to lose. Every day people lose their homes. They lose their savings. They go bankrupt. Every day we have hospitals and clinics going into debt, going into bankruptcy. Every day matters. So incrementalism, as in someday, no. This is urgent. Every day is an emergency for families in this state and in this country. And so incrementalism is not okay. It's unnecessary. It rewards and enriches those that are committing structural violence against us, and it endangers people and leaves them desperate in their most acute moments of vulnerability. So it's not okay to say incremental. No, we can do it all at once. It can be done all at once, and we need to do it all at once. Single payer, universal healthcare, nothing else.
Thank you, Maureen.
And, I think, to echo some of what's been said, is to make organizing part of like one of your ADLs, right? It's got to just be like an activity of daily living. Like, it's got to be kind of like, and to kind of understand, like, how do you make time and space for that in your day to day? I think that is a powerful thing for students to know, especially as you're entering healthcare, to how do you make organizing and solidarity with movements part of the work that you do. That it isn't just because like I can tell you that in my career and definitely in my education and training, advocacy was always like, oh, that's a cute extracurricular. Good on you for doing that. But, to really start incorporating it into the work, into like, how you move about in the world, what it is to be like, for it to be part of your professionalism, is I think like critical at this juncture. As far as like, I mean, and when it comes to the incrementalism part, just take it from someone like my first presidential election was Bush versus Gore. And, like I look back at these last 20 years and, the failures of incrementalism are bipartisan. I mean, like, I have been told that like, oh, like, we'll do a little bit at a time. The Columbine shooting was in 1999, right? And then Sandy Hook happens in 2012. There's mass shootings like, and I've been, and everybody can remember like any number of mass shootings and always being told that like, oh, like, we will get there someday. Like, right, as Maureen was pointing out, someday never comes. Like, it's always like, and there's always a blame game involved and like, but it's just that like, that we never really, like that instead what's been encouraged is an apathetic acceptance of death from gun violence. 2005, like I still remember, like it is seared into my head the way Hurricane Katrina devastated so many lives. And I was told that, oh, this is going to be a game changer. Fast forward, and we don't have, and like, and we've looked, the Green New Deal is seen as divisive. I'm like 15 years after Hurricane Katrina, we're still struggling with like something as basic as this. And so I think that it's worth reminding people that incrementalism has failures, but that we are, and that those failures represent an opportunity to stop doing it, like to really like, I mean, to shape up. And as I pointed out earlier, it is okay to, like revisit old assumptions that you had and and to just accept that they were wrong, and a willingness to to apologize to yourself, apologize to the people that have counted on you, and to say together we're going to do better than this. And I think that the more you can like create those spaces that are inviting for people to to share remorse, redeem, and and regenerate, the better. It's just that like we're not going to get there though by constantly clinging to old behaviors of power that have not delivered for us. I mean, like when the pandemic started, when people were shocked, like, I can't believe blah, 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 that Trump did this or that Republicans failed that. I'm like, we've gotten apathetic towards death. I mean, like how many, like, like there were any number of mass shootings, any number of climate change disasters. Like we like have always supposed to be the game changer, and nothing changes because there has always been an acceptance that incrementally we will somehow reverse the thing that brought us this pain until the next pain comes along, right? And so I would say that like the more that we can like look within ourselves and invite people to like reevaluate assumptions, express remorse for like what was assumed before and how that failed, and to like, I mean, recommit ourselves to each other for redemptive change. I think that that's powerful. I really feel that that is something that, I mean, can be enormously healing for people, in this movement. And as we, and as we grow it, I think that there are so many opportunities to be good, allies to other movements that are, that really, there aren't really other movements. Like there can't be health justice without environmental justice, and there can't really be environmental justice without health justice, that it also must include immigrant justice. And I mean, the interconnectedness of all of this, I think, is actually a beautiful way to grow as an organizer and to be organized yourself. And I would point to those opportunities that are in your immediate space. And it's challenging as a medical student. Like, I mean, you do not have bottomless stamina and time. It is a tough budget, but I think that just know that what you contribute to and what you put out there is going to be helpful to this movement if you keep intending it, and if you keep making the time and space for it, and support each other, and to really not really that solidarity within this community is huge. It is the most powerful thing that we've got, and it's what gives me the greatest optimism.
Thank you all so much.
Thank you.
I know we could just keep talking about this for hours and hours, and part of me wants to and wishes that could be possible. But referencing Dr. Sriram's, limits to med student bandwidth and all of your bandwidth as well, I think we should, keep the fight going, but maybe end the panel for tonight. So once again, yeah, thank you all so much. It was a really great conversation. Thank you all to USC and JMP SNAP for helping co-organize this. And I will send the recording to everybody who attended this meeting. But thank you all so much. You shook us a little bit from the apathy, I think, tonight. So thank you for that. And everyone.
Thank you for showing up and for sponsoring this. Thanks to everybody.
Thank you all so much.
Thank you.
Bye.
Bye.
Thank you.
Take care,
Bye.
everyone.
Thank you.